Ranking Member Slaughter. I appreciate the opportunity to testify before the committee. I'm the new ranking member on the Committee on Education and the Workforce, and protecting affordable health care for America's workers and families is a top priority. The fact of the matter is the Affordable Care Act is working, and we should not repeal it. Perhaps those who want to repeal the Affordable Care Act have a short memory, and it's important to remind ourselves what was taking place when we passed the Affordable Care Act. Before that, employer-provider insurance coverage was shrinking. There were months in 2008 and 2009 where 14,000 people a day were losing their health coverage. From 1999 to 2010, the cost of premiums for employer-provided health care insurance increased by 138%, while workers' earnings only went up around 40%. Those who were employed were often locked into their job, because if they lost their job, they would, or if they left their job, they'd lose their health insurance. And so some who wanted to retire couldn't retire because they needed their insurance. And every American family with insurance had a hidden tax of approximately $1,000 per family for providing for covering the cost-shifted indigent care. When people go to the hospital and don't pay, those that do pay have to pay a little extra. That's about $1,000 for every person with a health insurance. If we repeal the Affordable Care Act, we go back to those days. Thankfully, workers have the peace of mind of knowing that they have options. If employer-provided insurance is not available, they can enter the marketplace. If it's not affordable, they get tax credits to help them pay for the insurance. They know their dollars that they spend in insurance are going to health coverage. The 80% rule provides that 80% has to be spent on health care, not corporate jets and CEO bonuses. For those who have insurance, they experience the lowest growth rate in the last since the Affordable Care Act passed, in many years. Vast majority of large employers who provide insurance to their employees suffer less of an increase in premiums due to the cost shifting, because now everybody, just about everybody, has insurance. And so on and on and on, Mr. Chairman. The program is working. 3 million otherwise uninsured children or young adults have insurance on their parents' policies. Senior citizens are benefiting from the lack of the helping in the donut hole. Repealing of the law, we have to explain to people who have benefited why we have to go back to the way it was. I understand there will be a delay in the effective date of the bill that may be proposed in the rule, but giving 180 days, we haven't come up with a meaningful replacement yet. There's no reason to believe that delaying it 180 days makes it any more likely that there'll be an actual replacement. And all of the people who've benefited, all of the people who now have insurance, all of the people who now can afford life-saving treatments will go back to the days where they wouldn't have insurance and wouldn't be able to provide those that coverage. This is the 56th attempt to repeal or undermine the Affordable Care Act. It's a distraction. We need to work on ways that can possibly improve it, not just toss it out with nothing available to replace it. So, Mr. Chairman, thank you for the opportunity to be heard.
Mr. Scott, thank you very much.